Professionals in the counseling and mental health services pathway assist people with personal, family, educational, mental health, and career decisions or problems. Job opportunities include clinical and counseling psychologist, employment counselor, industrial organizational psychologist, marriage, child, and family counselors, mental health counselor, residential advisor, school counselor, psychologist, sociologist, substance abuse and behavioral disorder counselors, vocational rehabilitation counselor. Individuals in this pathway provide a variety of services depending on the career. These services may be provided in hospitals, clinics, schools, or private facilities and include studying the human mind and the psychological development of people, examining human interaction in a social environment, providing psychotherapy, and implementing behavioral modification programs. Professionals in this pathway are responsible for providing guidance and additional support to individuals. Guidance can range from daily advice to career help. Support in rehabilitation, advising, and parent education are also available from these professionals.
As an occupational therapist, I work in an inpatient rehab unit and I see patients of all ages with different diagnoses. Some of the diagnoses I commonly work with are brain injury, spinal cord injury, stroke, cerebral palsy, or sensory disorders. And I work with these people to try to go from a point of dysfunction to independence. So it may be something as simple as teaching someone how to use an adaptive technique to get dressed, or it may be something as complex as teaching someone how to manipulate their work environment from a wheelchair when they're used to doing it from a standing position.
Employees in this field must possess a strong desire to help others, good communication skills, a strong sense of responsibility, and the ability to work independently and as a team. Maintaining good relationships with clients and coworkers, and being sensitive and compassionate toward people are also important skills for this industry. Professionals must also have patience to listen to clients and wait for them to express their needs and wants. Analyzing and motivating people into action is required for these needs and wants to be met.
A day in the life of a counselor is showing up and having a slate full of appointments. It's usually between 4 and 6 appointments a day. More than that, a counselor is not going to be very effective. The first art of being a good counselor is learning how to schedule so that you don't put people who are going to be real difficult in the same day, and you have proper energy to deal with the kinds of situations that you deal with. Probably the average day in a marriage and family therapist's life is going to include at least 1 or 2 marriage counseling cases. We look at relationships more than a psychologist will guide a person to look inside themselves for the kinds of issues that are going on. Family systems therapists focus on the dynamics of relationships and how people are affected by those dynamics.
To be a good occupational therapist, you have to have great interpersonal skills and really be caring and patient and know how to communicate very well with a variety of people. It also helps to have good time management skills. It's very important to be a good communicator in my profession. You have to be able to explain the same thing in a number of different ways because you can speak to a physician in one way and you need to speak to a patient in another way. And so it's very important that people understand what you're saying and that you also understand what they're saying.
The need for confidentiality in careers within this pathway is paramount. Personal files and medical records are handled daily and must be kept private and confidential based on federal and state laws. These records must be accurate for future references about past problems or issues and how they were handled. There are a variety of career options in the counseling and mental health services pathway, resulting in careers for many different education levels. For example, a clinical psychologist requires a doctoral degree, a rehabilitation counselor requires at least a master's degree, and a mental health or substance abuse social worker can have either a bachelor's or a master's degree. Those interested in careers in this cluster should research the education required for a specific career.
I have a business degree, and then I have a lot of continuing education courses in mental health. And I have my assist training. It's actually suicide training. That's mainly where you find your skills on learning how to save life. There's a lot of continuing education classes out there that we take just to stay up on, what's going on out there. What are the trends? Are there any changes that we need to look for? Are the programs that we're doing successful? Are they actually effective? That type of thing.
Professionals working in private practices generally have their own offices and make their own hours. People employed in hospitals or nursing home facilities may work in shifts, which can include evenings and weekends, while those who work in schools and clinics generally work 8 to 5. In some instances, cases these professionals handle can have an impact on their life outside of the office. Individuals in these professions must be able to leave their emotions and personal life out of their career, and their career out of their personal life. There are many satisfying aspects of careers within this pathway. It is fulfilling for professionals to feel they have helped those who have sought them out for their expertise, whether it is someone with a complicated case or just asking for advice. Watching a transformation occur within an individual can provide continued motivation when working on a frustrating or complex case.
And I want to make a change. I want to be a difference. I want to spend the time I have here on earth making a difference, whether it's to kids, adults, or whatever. We're all put here for a purpose, and I want to use that in a very positive manner. I love working with people and changing that negative into a positive, and knowing that we've made a difference in someone's life, where we've changed their thoughts about suicide, that they know that they do want to live, that they know that there's hope and that there's help. And it's that honest, open communication that we try and teach everyone. It can change everything.
Well, it's watching people change and solve problems and work out the puzzles of their life, and having conversations with people, identifying what are normal developmental situations and then other kinds of snags, and watching them figure it out.
Professionals in the counseling and mental health services pathway are responsible for providing mental, emotional, professional, and physical assistance to families and individuals. Whether it is counseling a family through a difficult time or assisting with rehabilitation, there are many career options to choose from in the pathway based on personal interests.